Vitamin A, very important for the rhodopsin of the eye. Vitamin A, and or let's say we have K2 in there, right? Because if it's a fermented cod liver oil, we're going to have K2. That's going to help bring the calcium back in the bones. And then immune-wise, vitamin A is really important for the immune system. We may even do higher dose vitamin A acutely as a natural antiviral, which is really good too. Again, be careful with vitamin A, from a beta-carotene standpoint. That has to get converted. And if you have low thyroid function, that can easily decrease the conversion. So we always want vitamin A from an active source, and cod liver oil would be active. Again, the risk, high doses, could be an issue. High doses, once you're going above 10,000 IUs, if you're a woman who could get pregnant of that age, you've got to be very mindful of that. Again, I always tell patients if we're testing, we can always test for retinol and make sure you're not going too high as well. But again, at those doses, at 5 to 10,000 IUs, that's not too bad. I've seen studies looking at vitamin A toxicity where they start at about 4 to 6 months of 100 to 150,000 IUs per day. So I feel comfortable with what the data says out there at these doses being lower. But again, check with your medical doctor or just get your retinol levels tested via blood too. If you go too high in vitamin A, you normally see this with Accutane/tretinoin. You'll see some liver enzyme increase. So you can always, if you're on the fence, you can always run a liver enzyme metabolic panel too. Again, risk of heavy metals if you're doing low qualities. We're doing the best quality stuff, so that's not going to be an issue. So we always want to choose good quality. You get what you paid for. Plus, you don't want oxidized fish oils. Not good at all. Third-party testing, really important. And again, liquid versus capsules. Again, you'll get a better deal in liquid. So like there's some companies that are really good cod liver oil. There's Nordic Naturals that's good. There's Carlson's that's good. There's Rosita that's good. Right now, I'm doing the Rosita cod liver oil. I like the capsules because of, one, the taste, the burping issues, and also less oxidation. You can get a good deal on cod liver oil if it's liquid, so Carlson's is good. I find Nordic Naturals does not have enough vitamin A in it. It's a little bit lower on the vitamin A. I like Carlson's. Carlson's capsules, though, have soybean oil. I don't love that. So I'll go with their full bottle one, or I'll go with Rosita. There's only a couple of companies out there that really make a good one with good full spectrum vitamin A that I trust. So just be mindful of that. And if we're doing it in liquid, I want it in a glass bottle, which Carlson's would have. And they have good vitamin A on that. And again, cod liver oil is a stronger flavor. So usually we're going to do like a Carlson's lemon. That's a pretty good one. My kids will do that. Or we'll do the Rosita in a capsule. Again, it's about twice the cost though. So you got to figure out where you're at. If the taste is a little inconvenient, you spend a little bit more for the Rosita or for the capsule version. But if you want to save some money, you can always do the Carlson's, which I like. I don't have a omega-3 cod liver oil yet, but I would recommend my omega-3 Synergy. We get it from the best sources. So that's going to be a good one. Good EPA, good DHEA, good support there. Less prone to oxidation. We're doing independent testing to make sure the metals aren't there. I think we had all the big ones. And then outside of that, if you're having problems with the burping, take it with a food. Take it with your meal where you're going to have fat.